Hi, hello everybody. I welcome you all in another Ask Me Anything session, episode number 139. And today the topic will be 5 important tips for your pregnancy. I would like to welcome Dr. Kamini Patel ji, right from Ahmedabad. She is an infertility specialist and senior gynecologist at Vani Hospital in Ahmedabad. She has more than 30 years of experience in the field of gynecology and infertility treatments. She's an expert in IUI, IVF, surrogacy, high risk pregnancy, obstetrics, antenatal care, and menopausal care. She is also a member of the Menstrual Hygiene Program under FOGSI and AOGS. So, I welcome you, Doctor, on the session. Let's get started.
Thank you, Pooja. I'm really delighted to talk on iMumz today. Um, we are going to start for the general care of anxiety patients. Like everybody talks about big things, like how the medical care is being taken, but is anybody talking about how what is the see when the patient becomes pregnant? So, what exactly is needed when she conceives? Or there are some women and some girls who really want to know that what should we do before we are pregnant and what care we need to take before we conceive. Like, what is the right age to conceive? What is the right time to conceive? And let me tell you that the best time to conceive in this era is from 22 to 30. Too early a pregnancy is difficult, or too late a pregnancy is difficult. So, when the patient becomes pregnant, probably some women they do come before they conceive also. Like, what are the medications we need to take? Like, exactly, we don't need to give any type of medications other than folic acid and some multivitamins for the patients. So, folic acid we start quite early, 3 months before the conception, and that is the right uh, time period before the conception. So once she becomes pregnant, then the new thing starts. Like what next, and why she needs to go to the doctor. Like there would be some old people telling that no need to go to doctor so early. You can go later on. You can go after 2 months. But my advice is that go right on dot as soon as possible and as early as possible. Why? Because you need a proper counseling when you're pregnant. Why you need to go early to the hospital? Because if there is any complication, we can detect as early as possible. And why regular visits are possible? Because we need you to stay healthy and fit. When you are into a regular care of doctor, what happens that you and doctor, you people get connected to your doctor, to the obstetrician, to the gynecologist. So when there is anything wrong with you and your body, he or she is the first person to perceive that yes, I can see there's some change on your face, and because it's not matter of 1 or 2 days, it's a matter of 9 to 10 months. So we keep on observing that yeah, you look pale, you don't look happy. I can see some edema on your face. What we can see, you may not be able to see and identify and detect for yourself. So we need you as early as possible in our OPD. Uh, People would be telling, like the old people in the family also, go after 3 months, go after 2 months. But you being educated person, I wanted to convey, you come early as possible to our OPD so we can be hand in hand with you and we can walk with you all throughout your 9 months and a month later after 9 months also. So whom to choose? Who will we choose? Like, yes, okay, I'm pregnant. Whom will I choose to go to a doctor? I mean, do I want to go to a general physician? Do I want to go to a physician? Or do I want to go to a gynecologist? Yes, you need to go to a good OB-GYN practitioner. Then she is, you know, she is giving her best in pregnancy and childbirth. She is giving her best as far as the woman healthcare is concerned. And when she's concerned about you, he or she, when I say she, it's he or she, whosoever is your obstetrician. What next? When you really enter into the OPD, what do you want to? I mean, you're not entering to a sick OPD, isn't it? It's a very happy OPD. Sick unit is absolutely different when people are sick and they are going to doctor. You people are not sick. It's a very happy OPD. When we are consulting a pregnant lady, we feel very happy. And so you have to feel happy. Now, not not all patients have to be complicated when you are visiting the OPD. Even for you can, as I said, you can visit a happy OPD also without any complications. Like just seeing your doctor, doctor is telling yes, you're fit, your baby is fit, everything is fine and happy. I would say this is a happy OPD. But well, she needs to come in very close contact with you to detect any problem or any complications which is heading on to you, isn't it? If you don't give her the chance to identify, how will she know and how will she guide you? So when you are entering a non-complicated OPD, like first 28 weeks, we would want you to come every 4 weeks. 28 to 36 weeks, we would want you to come 2 weeks, every 2 weeks. And our 36 onwards, we would want you to visit our OPD every week because that's when the clock starts ticking. Nonetheless, it's not necessary that my doctor has told that no, you need to come after 4 weeks, so I have to go to the OPD after 4 weeks. Yes, if you find any problem with yourself or with your body, you can go and visit your doctor. Certainly, I mean, anytime you can take the appointment and walk in. What exactly the doctor does? What do we do when you enter into our OPD? When we detect the pregnancy, we have to see that is there any complication going on. Other than that, we have to keep the pace with your weight, blood pressure, and the scan. It's not necessary that we have to do the scan every 15 days, but we would like to do the scan every 4 weeks. Well, as I said, to detect anything going wrong, we have to do the scan. And the misconception as far as the sonography is concerned, that yes, my baby will be hurt with the x-rays and my baby will have bad rays on the brain and the heart and so many other things. Well, let me tell you that ultrasound works as it says it works on sound waves. So there are no x-rays that are transmitted to you nor your babies. So be comfortable when your doctor is doing the scan. Don't get hyper and don't get scared. As the name says, sound, it works on this waves. When the routine investigations are going on, we would like to do the routine blood investigations and the blood workup. With that, we would like to repeat in all the trimester the blood sugar, thyroid in each trimester, and we would like to have your thalassemia also. Once the routine blood investigations are done, unless and until we find anything up and down, we would not investigate you in a deep methods. Now, how far the scans are important? When we talk about the scan, it's of course an indirect study, but when we are doing a 4 weekly scan, it's routine to just see your baby growing happily and if anything wrong we perceive. But the major scan is at 13 weeks, that is called as empty scan, which detects and which tells us something as far as the genetics are concerned. The second major scan, it is a TIFA scan that is done at about 21 to 22 weeks, where we come to know about the major physical abnormality. So these are the two major scans in overall period of 9 months. And once this is done, what we want to do in the third trimester is the growth scan and the color Doppler. We detect so many things with the color Doppler and your growth scan, like whether you are more prone for eclampsia, you are more prone for premature deliveries, or whether you are more prone to development hypertension. And there are multiple things. Yes, looking at your cervical length, looking at the uterine blood flow, looking at the blood flow in the placenta and the cords. We would tell you so many things in advance that yes, At 3 months, that is a 13-week scan, if we find the cervical length around 3 centimeters, we would let you know that yes, you are more prone for a premature delivery and what precautions you need to take, what exactly you need to do. And again, on the 21st week, again, if we see anything wrong as far as the cervical length is concerned, your uterine blood flow, we would let you know whether you're more prone for to develop blood pressure, hypertension, are you going in for preeclampsia, whether what is the relation of the baby and the placenta, and the liquor, and so many other things. As I said, in all the trimester, each and every trimester is important. The first trimester, where the baby is growing and the organogenesis is happening, is very important as far as we are concerned, because maximum organogenesis and the development of the baby is completed by 13 weeks, and later on the development goes on uh, after 14 weeks. So as I said, an ultrasonography is an indirect study. Now, if the doctor finds anything wrong at about 13 weeks, we don't want to confirm with the direct study. We would advise you to go for a direct study. Now, what are the other direct studies which are important as far as our study is concerned? Like chorion villus sampling, amniocentesis. If we find this, like, if you want to do a detailed study as far as the genetics are concerned, we would advise you well in advance that take up an CBS, and we can have a complete microarray. We can take up an amniocentesis, and that is the fluid which is around the baby. We can remove that fluid and send it for the complete microarray. Means all the chromosomes are examined, and we would let you know exactly that what is there any problem or not. If there is a problem, we can guide you further. So don't get panicked, don't get scared when doctor says that further investigations are required. Like, you know what happens, we do a LT scan, we find some problem, we wait for another 15 days, yes, the problem gets confirmed, and we would want you to enter into a direct study, and suddenly the panic starts. Now, when the panic starts, what happens? We would want to go to somebody else. Yes, of course, it's your right to take up the second opinion, but take up with a pinch of salt. Take up when people going for a second opinion, well, go with the same experience or little bit more experienced doctor. Like if the doctor with experience of 30 years, if he or she is telling you something, there has to be something. Now, if you can't go and take the opinion of the doctor who has passed just 1 year, who will not be able to opine. So then you have to take an opinion from a doctor who is little bit senior. He or she will be able to guide you better. Yes, second opinion is very much necessary, but after the opinion, you don't have to say that no, this doctor has given me the bad investigation, so I'm not going to go with this doctor because she has given me an invasive procedure. Why she has advised you invasive procedure is for your betterment. So we find out the problems little bit early. What exactly, what are the problems we come across in our routine antenatal patients where you are also you need to take care? The common problems where we come across, like the medical part and the medical disease, like diabetes, the thyroid, hypothyroid, preeclampsia, and RH incompatibility. What exactly happens when there is a gestational diabetes? And the diabetes, gestational diabetes is the detect when you detect the diabetes once the lady is pregnant. And if a diabetic lady has conceived, she does not qualify for a gestational diabetes. She is a diabetic lady who has conceived. Now she needs a proper care where the physician is involved here. Now we are not almighty that we will do and we will treat everything. So we want a hand in hand of a physician who will take care of you. Of course, we are half physician, but we will need a physician where a second opinion is necessary. Like at least 3 times in for your 9 months, and rest we can take care. So when a diabetic lady is getting pregnant, she needs to know that that she has to be extra careful than the lady who is healthy and who is conceiving. As I said, the second point we are going to take is thyroid. A lady with hyperthyroid or a hypothyroid conceiving is absolutely a different matter. Then we identifying a problem at about 4 months or 5 months. And we find out that okay, her TSH is high, her TSH is low, and we need to guide her better way. Sometimes the pregnancy is such a state where we would find that thyroid can go up and down. So don't panic and don't say now the thyroid is going to stay with me and now what happens? I don't need to take any tablets and I'm not going to take any tablets. I will go to some other Ayurvedic doctor. I'm going to get treated with Ayurvedic, but I'm not going to take allopathy. No. If there is a hyperthyrotoxicosis, that is hyperthyroidism, it's going to deter the brain of your child and even hypo. So we want a correct measurement of a thyroid during the pregnancy. So we need to be very careful and we have a bit thin margin going for thyroid. So and I like to be very balanced and so like other obstetrician would also like it to be very margined as far as the thyroid is concerned, as far as the diabetes is concerned. Leaving this too, I would like to discuss something about the preeclampsia, like hypertension and pregnancy. A hypertensive lady conceiving, she needs to again walk with your physician because the tablet she would be taking, it may not be the correct medication during pregnancy. So when you come to a gynecologist, she needs to again consult. I mean, you need to consult the gynecologist. Yes, I'm taking these tablets. You have to tell them because the blood pressure can be normal and she doesn't know unless and until you tell her that you are hypertensive. So if you tell her, she would know and she would exactly look into the paper and she will tell you whether these medications are exactly in sync with the pregnancy because there are the medications which would be contraindicated in the pregnancy. So she would talk to your physician, discuss your further line of treatment, and she would advise accordingly that this medication is okay. And there are, I mean, if we talk about the preeclampsia is a condition where she develops hypertension on the second trimester, that is after 5th month. She would develop the edema, and with that, she would excrete some amount of protein in the urine. When this triad is there, we would define her to fit into a preeclampsia. Now, when there is an preeclampsia or where the lady is detected as a preeclampsia, now you are coming into high risk. So every 10 days to 15 days, you need to do a follow-up with us, and we will do a very close follow-up so you don't end up having any complications further. The fourth most common thing what we find is an RH incompatibility. What exactly happens with an RH incompatibility mother? Like if she is negative, if her husband is positive, and we don't know what the group the child is possessing. But if the mother is negative and if she is conceived with positive, what happens? The antibody gets released in the maternal blood, where it crosses the baby. I mean, it enters into the baby's blood and it destructs and destroys the red blood cells of the baby. It is a manageable condition provided you are close with us. But we cannot manage when you come after the complication is there, isn't it? So everything is manageable. You talk about diabetes, you talk about thyroid, you talk about preeclampsia, you talk about RH incompatibility, and you talk about anything, everything is manageable provided you are with us. So the first and the tagline is you have to be with us. Now, most common thing the girls and the ladies would ask us that, ma'am, what diet we need to have and how much weight gain we need to, we need to have during full 9 months. So as far as the weight gain is concerned, see, what I advise is Don't go go on an extra vacancy for the first 3 months, because we save it for this another 2 trimesters. Because in first 3 months you can always plan your diet and see to it that you don't gain an extra weight, and you leave for the second and the third trimester. What important is, like, you should have more fruits, more veggies, and more grains. Balance your diet with all these things. Have a high protein diet, low carb, have more veggies, and the fruits. You need to have folic acid, iron, and calcium. In the second trimester, I mean the second and the third trimester, really doctor will advise you to go with an iron formulations and the calcium formulations. You need to have a vitamin D in the second trimester. I I feel it's a must in the second trimester. And the weight gain I would suggest is not more than 10 to 12 kgs over the period, spread it over the period of 9 months. So this is what, like, you cannot afford to go for a weight gain about 20 kg. Now, if the lady is gaining an extra weight, of course, the doctor will come to me immediately, and she will look into the other problems where, like, if you're heading for a diabetes or if you're hypo, and she will investigate you further. Now, the most other common thing, what other questions are being asked to us is, doctor, how much rest should be is required? Some people would think that, okay, 9 months is full rest, rest and rest. I feel that you can work and you should work in all 9 months for your well-being, your physical activity, because when you are working, like 80% of the women right now would be working. I feel if there is no complication and if the bed rest is not required, if you don't have lateral abortion and the bleeding during your pregnancy, and if you're very happy with everything, why not work? So I feel this would we would consider as your physical and mental exercise, and you should be working if your body permits you. Like, for some women, the working would be an extra mile, like traveling for about 8 kilometers per day, or maybe 8 10 kilometers per day. For these type of ladies, I would feel that we can find out the job which closer to your hospital, I mean to your house, and amicable place where you can work. The girls and the ladies who are housewife, I feel the household work is the sedentary work, and you should not stop working unless and until there are any complications. Now, what type of food should be avoided? During pregnancy, like, I feel the soft cheese, where there are chances of toxoplasmosis, we should avoid that. Unpasteurized milk, raw eggs, and uncooked meat and uncooked vegetables. Also, I mean, okay, you can go with veggies, uncooked veggies, provided you wash them properly. So, with the food, the girls would ask us that, doctor, should I go for soft cheese? I always tell that, no, the soft cheese during pregnancy, I don't advise. Now, what are the vaccinations which are necessary during the pregnancy? Now, Centers for Disease Control and Prevention, they have advised uh, the module for vaccination as well. As everybody knows, tetanus toxoid is essential during pregnancy, but the CDC has advised a Tdap vaccine also, Boosterix also. So these vaccines, they take care of and of course the vaccine for flu. 28 weeks onwards, we do vaccinate for flu, and 32 weeks we would vaccinate for the pertussis. So, of course, the tetanus is important, flu vaccine is important, and the pertussis vaccine. So, all in one, there is available. A 3-in-1 vaccine is available, which we advise on 32 weeks. So, these are the vaccine protocol for the uh, women which you want to know during pregnancy. And What are the physical changes and the physiological changes where the woman should expect during the pregnancy? Like she should not be caught that oh, this is happening and why this is happening. So if the lady and the women comes very in advance to our OPD, it is our duty also to advise you that you should, what are the symptoms you would be facing when you are pregnant or once you're pregnant. Okay, we need to say that your first trimester you would feel nausea. If she has come at 5 weeks, she will not have a nausea or vomiting, but it's my duty, I will always tell that if you have any nausea, if it is tolerable, fine. If it is intolerable, come down, we can prescribe some medicine for you. And the medicines which are available for the nausea and vomiting, they are not medications. There are some vitamins in a higher dose where we can give them, and over the or spread it over the daytime, and yeah, we should be fine with that. So I would tell them that yes, you would have some nausea, vomiting, constipation. You may develop in the latter part, not all the illness, but you may have a tendency to develop piles if you have, and chronic constipation. Little bit of pain, cramps here and there, leg cramps you may have sometimes. And what you should be doing to avoid the leg cramps, you may have backache. These are the normal physiological symptoms where you did not panic. When suddenly you start peeking out, don't panic. It's a normal condition during pregnancy. Yeah, you feel like throwing up with the smell of some food. Don't panic. This is a normal condition. Suddenly she gets constipated and she's, oh my god, what's this happening? 3 days she has not passed, and you should make them aware that okay, the constipation is part of the story. uh, but what are the symptoms when she needs to call the doctor immediately? What are the panic symptoms? Yes, if she is having bleeding during pregnancy, sudden loss of fluid, if she passes the fluid at 6 months, 7 months, yes, she needs to call a doctor. If she has a total loss of the baby movement, how long she should wait? If she's not feeling the baby moving for an hour, she should wait more. When should you be calling us? Exactly, if you don't feel your baby moving, wait, lie down for 1 hour. If you don't feel your baby moving in an hour, you should be calling us immediately. Like when you find sudden cramps in your abdomen and you're not able to move, you should go to the doctor and report immediately. So these are the small tips you should remember. And what is physiology and what is pathology? Physiology is the normal things what we are going to face during pregnancy, and what are the pathological symptoms where we need to, literally ring the bell and call the doctor. So these are the small tips which I would like to convey. Yes, Pooja, anything?
Thanks a lot, doctor, for wonderful insights. And yes, we have got a lot of queries. So shall we get
Really?
started?
Yeah, I don't mind it.
Okay. Very first is from Pratima. She's 30
Yeah.
weeks pregnant, and when she conceived, her weight was 50 kg. Now it is 54.650 grams. So is it low or normal according to weeks?
Let's see. Hi, Pratima. You are putting on less weight, but if your baby is fine, you should be aware how much your baby is putting on weight. If your baby is putting on weight nicely and you're going sync with your 30 weeks pregnancy, is fine. But I think you need to eat more and put on a little bit more weight.
Thank you, doctor. Next is from Ashwarya. She's 7 weeks pregnant and she's 97 kg overweight. Please tell her do's and don'ts. Her blood and urine tests are normal, and also she has sweet tooth. So, what can she do to control her cravings?
So, hi Aishwarya. Well, you know, yeah, that you're overweight, but cut down your sweet tooth immediately. have a full control on sugar, and go and contact your doctor, and she will advise you, because I think she will investigate you for thyroid and diabetes also. But since if your thyroid and diabetes are under control and normal, you need not worry. You are in high risk. 97 is high risk. So go to your doctor every 15 days, and she will let you know what exactly and how to go further. But no sugar.
Thank you, doctor. Next is from Shweta. She is in her 29th weeks of pregnancy and sometimes she feels very strong kick. What does that mean?
Hi Shweta, 29th week and strong kick means your baby is perfectly fine. But if you're hungry and if your baby is kicking very strongly, have something to eat fast.
Thank you, doctor. Next is from Mansi. So she's asking, can we do waxing under legs in 5th month of pregnancy?
Yeah, like 5th month of pregnancy, I think vaccine is safe. We don't advise the hair removing lotions, but vaccine I think it should be safe.
Thank you, doctor. Next is from Nirmala. So she suggested to take Sustain SR200 from the 5th week of pregnancy to till date. Now she is in her 20th week. Is it normal or anything worried about?
Since you are on sustain, I think your doctor is expecting something. Maybe she is expecting that you may have you're more prone for premature labor, or maybe you have a short cervix. You discuss it out with your doc. Since she has put you on sustain 200, I think she wants your uterus to be relaxed. So you ask her what is your cervical length, the length of the cervix. She will be able to guide you better. Nothing to worry.
Thank you, doctor. Next is from Sarika. She is 7 weeks pregnant and she is asking, is use of mobile phone harmful for baby?
Extra use of mobile is definitely harmful, and don't keep your phone very close to you when you are sleeping, because first 3 months uh, you need to be careful as far as your usage of mobile is concerned.
Thank you, doctor. One more question she has.
Yeah.
For the last 2 weeks, she had a hard toilet problem and it's very painful. Her tummy is also very tight. So, what's the solution for this?
She is the same lady with 7 weeks.
Yes, doctor.
um, See, if you have problem, I just told that constipation is quite normal. So there are laxatives available in the market like loose and cremafen. You can have it and adjust the dose from 1 teaspoon to 2 teaspoon, and you'll have a loose stool, so you won't have a painful uh, passing. And if your tummy is tight, maybe because of the constipation, so once you're relieved of your constipation, you'll feel absolutely fine and you feel hungry also.
Thank you, doctor. Again, there is a question for vaccine at 34th week. Is it safe?
Yeah, Saurabh, your wife is safe. 34 weeks you can do vaccine, no problem.
He has another question. Can they go for stem cells?
See, as far as the stem cells are concerned, do you have anybody in your family who has abnormality or who has problems? If not, you can ask the stem cell people. They can come and do the counseling at home. You decide for yourself, because see, right now all the stem cells, whatever is taken, is going in for children pool, and whenever you require your stem cells, they can do the typing and they'll give back to you. There's no harm in doing your stem cell preservation.
Doctor, there is another question. How is it helpful?
Sakshi, yes, stem cells are helpful normally if you have any abnormalities going in the family, like there are so many conditions you must have read in your stem cell preservations counseling. In all those conditions, like conditions which runs in the family, where the stem cells are helpful, and sometimes these stem cells can be helpful for your treatment also in your latter age. And it's not necessary that only if you preserve you'll have your stem cells. You can like can avail the stem cells. Otherwise, also there are so many stem cells banks available right now. But if it goes in the pool, it's good.
Thank you, doctor. Next is from Sneha. So when she tested urine using pregnancy kit, she got faint pink line, but during the same month she had a bleeding for 2 days. So this faint line indicate positive or negative? If yes, then what is the reason of that bleeding?
Like it depends on what day you tested. And once you have tested, have you reported to your doctor or not? If you have reported to your doctor must have done the sonography. And she would let you know after doing the sonography that if you're lagging or you are in sync with your date. Sometimes what happens, you conceive in the latter part of the month. Like if you conceive after 15th day of your period, sometimes you may find the faint line like this. But then it is a lag of about 7 days that you will, the plus and minus, it will happen. I mean, by the time you end up your 9 months, um, this will, the calculation will be done. So nothing to worry. It depends upon if you have conceived in the first part, maybe the pregnancy test will show a very strong line. But if you're pregnant if you're conceived in the second part, you may show a faint line.
Thank you, doctor. Next is from Balwinder. She's 34 weeks pregnant and she has increase in her left itching full body. She doesn't feel good and there is swelling on her feet and pain in her legs and back pain.
Yeah, well, that this needs to be worried of. See, complete. I mean, if you're having an itching full body, please go and talk to your doctor. You have a swelling also and a back pain also. So when there is a swelling, we want to diagnose your thyroid. We want to see the thyroid level. We would like to investigate for you with your blood sugar and a protein. I would like to do a protein also because sometimes in even hypoproteinemia can give swelling. Look into your blood pressure, and if there is itching, sometimes the itching can be because there would be the collection of what I would say the well, sometimes when we take a UDLIF, it gets cleared off. I don't know the layman word in this, but there is a backlog and it gets cleared. Then the doctor would prescribe medicine for you. But yes, as far as your swelling is concerned, you consult your doctor immediately.
Thank you, doctor. नेक्स्ट इज फ्रॉम साक्षी. उनका 12 वीक चल रहा है और उनके टमी में कभी कभी चुभन एंड पेन फील होता है. आज उन्हें लूज मोशंस भी हैं.
So this chuban and that feel must be because of the loose motion. If you're eating anything outside, stop eating. Have a good healthy food, and I think the best gut friendly is the curd. You can go for curd and khichdi for 3 days. See if you're fine is okay. Otherwise, you can consult your doctor. Maybe because of your loose motion, you may be having pain.
Thank you, doctor. Next is from Jyoti. Her 5th month is running and she is taking progesterone vaginally. She's feeling itching only in night time on labia when she is taking progesterone. She had taken UH3 that time. Is it okay?
Because see, it's only an external itching. Sometimes when there is a vaginal progesterone insertion, sometimes the vulva becomes very itchy. So what I would suggest is there is an ointment available called as Candid B. You can apply this ointment and you will be off it. And you can wash with water. It's very safe.
Thank you, doctor. Next is from Vani. She's 27 weeks pregnant and yesterday she felt sudden sharp pain on vagina thrice. She immediately lied down and pain subsided. Is it a serious issue? Does she need to go to hospital?
Yes, Bhanu, Sudha, you need to go and consult your doctor. Please take the appointment tomorrow and go. It's not a serious issue, but you need to go and show it to her because she'll do the examination and she'll let you know whether is there any cervical dilatation or not.
Thank you, doctor. Next is from Samatha. She is 32 weeks pregnant and she has some doubts. She is having little white discharge. There is no smell and it's thin, milky in color once a day. So, is it normal?
How many weeks you said? How
She
many
said,
weeks you
doctor,
said?
32. 32
32
weeks.
weeks. Okay. Um, if there is no itching, you need not worry, but it can be a one sort of fungal infection. So why don't you go and consult your doctor? Because see, you are nearing your term. Any type of vaginal infection will affect the baby and you both. So it's better you go and consult your doctor.
Thank you, doctor. She has two more queries. Can
Yes.
she sit two-sided on two-wheeler?
Be careful when you're sitting.
And can she sit crossed leg Indian style on floor or sofa so that it can initiate the labor pain?
See, sitting cross legs on the floor or the sofa is not going to initiate your labor pains. Yes, you would be more flexible in your movements. Sitting cross legs, that is a different thing. But I mean, sitting cross legs, if you say, because initiation of labor depends upon so many things, and it's very scheduled, right? So don't have that wrong idea and wrong notion that if you sit on the floor and if you do jhadu pocha, it's going to initiate the labor pains because the time is already set. It has, I mean, setting of the labor pain depends upon so many other physiological conditions going on in the body. It's not only the physical conditions like bhar jhadu maro, pocha maro, and initiating the labor pains, isn't it? So if you want to sit, sit if you're comfortable, but don't wait for initiation of the labor pains when you're sitting cross legs.
Thanks a lot, doctor. Next is from Amtullah. She's 17 weeks pregnant and sometimes she feels a tingy feeling in her back and spine. How can it be cured and is it normal?
Well, these are the small pains here and there. As I said, small pains here and there, and the abdomen and back, it will go on, nothing to worry. But I think she should be very thin if she is feeling this.
Thank you, doctor. Next is from Ritu. She's better thalassemia minor. And please let her know till when folic acid can be continued and also when iron and calcium is started.
Ritu, your gynecologist will advise you to continue with, folic acid throughout 9 months. And I think she will get your blood iron report, repeat every 3 months. Because sometimes what we see that the girls with having a beta thalassemia minor, they have a very low HB. So they need to have a very constant and a very close follow up on these women with the beta thalassemia minor. Nothing to get scared, but if they are on the lower side, they may advise some iron components for these girls. So, yes, you need to take folic acid.
थैंक यू डॉक्टर नेक्स्ट इज फ्रॉम मोना उनका 8th वीक चल रहा है और उनके बॉडी में इचिंग हो रही है उन्हें वॉमिट भी बहुत है खाने का मन भी नहीं करता है और टेंशन की बात तो नहीं है ना कोई
Not at all. As I said, the vomiting is a very normal condition because when there is no vomiting, sometimes we may worry, but if there is vomiting, everything is perfect. But if you are having an extra vomiting, well, go to your doctor. She may prescribe some medication. As I said, they are not exactly medicine, but कुछ हैं applied medicine उससे आपको vomiting कम हो जाएगी. Nothing to worry.
Thank you, doctor. Next is from Ritu Goyal. Her ninth month is running and she is getting white discharge from yesterday, and there is back pain also. What does this mean?
You need to go and consult your doctor tomorrow, because white discharge I don't like on ninth month, nor even back pain. So go and consult your doctor. She will let you know what whether it is to be worried or not.
Thank you, doctor. Next is from Dasa Teju. Her last LMP is 10th of December. And when will she get delivered? And what to do to get pains and what to do for normal delivery?
I hope you are in close contact with your doctor because you are nearly term right now. So, if you're not visiting your doctor regularly, go and visit her, and she will be able to guide you better, because this is the last one going on. And I would like my patients to come into my OPD every week when the ninth month is going on. So, she would be able to advise you better. Go and see her tomorrow.
Thank you, doctor. Next is from Lakshmi. She's in her 27th week and is a hemorrhoid common in pregnancy during motion? She's getting much pain and some wound has come.
Yes, as I said, because see, if there is a constipation and unaddressed constipation, it will end up having hemorrhoids. Because pregnancy is notorious to give hemorrhoids. So if there is constipation, don't get shy. Tell your doctor that I'm constipated. She will prescribe. And if at all you don't want to talk to her, Crimafin is available. Smooth is available. There are so many medications which are available over the counter. You can take Crimafin is very Nilpesh. So you can take that and see to it that there is no constipation, because if there is constipation there will be hemorrhoids and then piles and bleeding, and as you say, the wound is also there. So, and there are local ointments also, like Innovate. You can immediately buy and start using it, apply it. You can apply 3 times a day.
Thank you, doctor. Next is from Samiksha. Is cervix length of 25 at 34 weeks is normal? What precautions she can take? She is taking Jubilant 10 mg BD and Sustain SR 300 HS. How long does she need to take them?
Well, Samiksha, you are already due. 34 weeks means you have already completed. So 25 cervical length at 34 weeks, I would consider normal. And about taking duodenal, your doctor will advise you, because when there is maturity of the baby, lower end of the femur जब भी develop हो जाता है, then your doctor will ask you to stop probably duodenal. So she will be the better judge when she is examining you.
Thank you, doctor. Next is from Archana. She's in her 37th week of pregnancy. Still, baby hasn't dropped down. Will she have to go for C-section if baby doesn't drop till 40th week?
Uh, if you have consulted your doctor would have told what is the position of the cervix, whether the cervix is soft, and if the baby is not dropping down, and she will do your pelvimetry. That pelvimetry is the size of the pelvis and the size of the head of the baby. That is called as pelvimetry. She will take the judgment and she will let you know. And if at all the baby is not dropping down, that means your pelvis is not big enough to take the baby, then she will advise you to go for C-section.
Thank you, doctor. Next is from Lavanya. Can she take folic acid tablets before trying to conceive without doctor's consultation?
Of course, yes. Folic acid. I would say it's a amrit. So even if you're not trying to conceive, you can take folic acid. And of course, this COVID era, I would suggest everybody can take folic acid and vitamin C.
Thank you, doctor. Next is from Divya. She is having tooth pain frequently, which goes upon using home remedies, but facing it frequently. Dental clinics are mostly closed nearby her home. So, should she visit a dentist or it's common in third trimester?
No, 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 no. It's not very common unless and until you are having some tooth problem. But now, since you have entered into a third trimester, no dentist will do any workup as far as the tooth is concerned. So you can take some painkiller, not like the painkiller. Ask your doctor and take. I think paracetamol would be safe. So if you have a lot of pain, do a mouth gargle, take paracetamol, finish your pregnancy, I mean delivery, and then consult a dentist. By then, I think COVID would be done with.
Thank you, doctor. नेक्स्ट इज फ्रॉम आकांक्षा. उनका 19 वीक पूरा हो गया है और उन्हें दूध पीना अच्छा नहीं लगता है, सो क्या करें? और प्रोटीन पीना भी जरूरी है.
तो दूध पीना अच्छा नहीं लगता, प्रोटीन भी जरूरी है, तो प्रोटीन बिस्किट्स अवेलेबल है. If you can be off with milk for 1 or 2 days or maybe a week, if you're off looking at the milk, ठीक है ना, छुट्टी दे दो एक हफ्ते के लिए, प्रोटीन बिस्किट्स अवेलेबल है. यू कैन गो विद द प्रोटीन बिस्किट्स लाइक थ्रेप्टिन बिस्किट्स आर अवेलेबल, GRD biscuits are available. They're quite tasty. You can complete your protein quota in that and have a high protein diet. So चलता है, एक हफ्ता नहीं पियोगे चलेगा, फिर पी लेना.
Thank you, doctor. Next is from Ashwini. She is 25 weeks now and she often faces pain in the pelvic region. Is it usually after she wakes up? Okay, it is usually after she wakes up from sleep.
अच्छा, so I mean, uh, this pain is, it's very intense. Go and show it to the doctor, because once you are up from the sleep, it should not pain. You are more relaxed when you're sleeping. But if it is paining when you are up from the sleep, talk to your doctor and tell her. She will prescribe some tocolytic agents, like we heard from the other lady. She's already on duodenal. You can take duodenal after consultation with your doctor.
Thank you, doctor. Next is from Koluru. She is in 29th week of pregnancy and she feels pain in her vaginal muscles while waking up from bed and also while stretching the legs. Is it common during last trimester?
No, it's not very common on 29th week. So when you are next in your next visit with your doctor, you talk to her and tell her that this is the complaint. Right?
Thank you, doctor. Uh, so in the next 34 weeks of pregnancy, done LFT test, SGPT, DSOPT are high, having intense itching, can't sleep at night, taking Udilip 300 twice daily, using Venusia ointment, but still it's itching. Please give remedy.
Yes, I would not advise you. I mean, you can take anti-allergic like Diovan occasionally, but I don't like to prescribe anything other than Udiliv and the local ointments. So if you are not relieved with the ointment, sometimes you can take Diovan, uh, but no, don't make it a habit to take that. You'll be relieved of your itching. But anyway, you are ending up your term. So you're already crossed 34 weeks. So you may not have to tolerate much more. Maybe in about 2-3 weeks you'll be delivered. So don't worry.
Thank you, doctor. Next is from Anshika. उनका placenta lower lining पे है. इससे कोई problem तो नहीं होगी ना?
हाँ होती है ना. So lower lining पे है, that means your placenta is in the lower segment. So better be careful. Don't have a jerky journey. Don't keep on jumping. Have a slow rise in the steps, and when you're walking also don't keep on jumping. And I think your doctor must have advised you. So if the placenta is in the lower segment, you have to be a little bit more careful.
Thank you, doctor. Next is from, okay. So she is 6 weeks pregnant. Is it safe to ride scooty and bending is okay? Like managing 9 hours job and then household work?
I told you that if you have no problem at all, I think everything is fine, because people do work for all 9 months. If there is no problem and no complications at all, I mean, you're fine. You can ride scooty if the roads are good, and do a 9 hours job also.
Thank you, doctor. Next is from Anjali. LMP was on July 15, but on 19th August, bleeding happened for 5 hours with few clots. Then again, after scanning, came to know that heartbeat has been started. Also, heartbeat was 100 and growth was 3.1 for 5 weeks, 5 days.
Yeah, it's a little bit on the lower side, but since the heartbeats are there, that also I feel it's bit. But I think we can wait to next follow up in about 10 days, and your doctor must have prescribed the medicine. Continue with the medicine. There are tocolysis and even the other medications which are available. She must have given you. Wait and watch. Do the follow up. If the baby is growing every week properly, nothing to worry then.
Thank you, doctor. Next is from Shazia. She's 31 weeks pregnant and due to lockdown, she hasn't done any test. Can you please suggest her what test to be carried now and how can she have a normal delivery?
Oh dear Shazia, because the lockdown was still on and the obstetricians were consulting, you should have taken the appointment and gone to a doctor. 13 over 31 weeks and you have not done no investigations, it's not right here. Not even a scan, you should go to a doctor, get yourself consulted, get a scan done and get all the investigations, whatever she advises you, because you're already late. Please go and consult tomorrow because doctors are not locked down.
Thank you, doctor. Next is from Nasreen. 25 weeks of pregnancy and feels sharp pain in upper pelvic region while walking and sometimes while getting up. Also, sometimes she get bump in pelvic region, which is painful.
Yes, naturally. See, you have a severe contractions, uterine contractions. So I think you go and tell your doctor. She will prescribe some tocolytic agents, and you'll be fine. Like duodenal. See, the other girl was taking duodenal, so you can always go consult your doctor and start taking that.
Thank you, doctor. Next is from Amrita. It's her first pregnancy and currently in 32 weeks, feeling tightness around her stomach, for which she has been recommended Duvadilin 1 tablet daily after food. Is it safe to start this medication?
Yes, Amrita, it is very safe. Start immediately.
Thank you, doctor. Next is from Mansi. She took overall G for 21 days in her first trimester and she went for anti-scan. It was normal. So overall G is harmful to baby?
Why why you need to take oral G for 21 days in the first trimester in the first place? Anyway, now if the NT scan is normal, we just wait and watch.
Thank you, doctor. Next is from Shajia. She has anterior placenta and she is 31 weeks pregnant. Can she go for sex?
Be careful.
Thank you, doctor. Next is from Shweta. उनका लास्ट पीरियड 28 जनवरी का था एंड उनकी डिलीवरी कब तक होगी शी वांट्स टू नो इनकी फर्स्ट प्रेगनेंसी है और इन्हें हाफ एन आवर भी खड़े होने में प्रॉब्लम आ रही है बैक पेन भी काफी हो रहा है सो क्या कर सकते हैं
Shweta, I think you must be going on with your ninth month. You must have already started. So why don't you go and consult your gynecologist and ask her to do a scan? I mean, she will do, and of course, examine you per vaginal. Because if you are having pain and even if you can't stand, I think your baby must be a little bit low down. Why don't you go and show it to your doctor?
Thank you, doctor. As Samiksha asked about like she's taking these medicines, so she's asking, does taking these medicines which she has said, Duvadulin 10 mg BD and Cysteine SR 300 HS, will it cause any low amniotic fluid?
No, not at all. No, no.
Thank you, doctor.
Thank
Next is from Ritu. How much folic acid is required? Her hemoglobin is 11.9.
you. Ritu,
And
your
she's taking 400 IU now. Till 3 months, she continued till 5 mg.
yes, 5 milligram is enough, and you have got good HP 11.9, so you need not worry. But anyway, you can take 5 milligram. It's a good dose.
Thank you, doctor. Next is
Yeah.
from Anshu. It's a 21 weeks of pregnancy and have a nerve compression on her right lower back. How can she help it as it is affecting her daily routine? She feels very depressed due to pains all the time.
Anshu, why don't you? I think Anshu should be. I mean, she with this complaint. I think she's quite skinny. So if she is skinny, I would want her to put on a little bit of weight and consult the yoga consultant, because there are some girls, I mean some yoga consultants who are giving a good exercise during pregnancy. 21 weeks is the right time for her to do some good yoga, and doing good yoga and exercise, it will relieve her of pain.
Thank you, doctor. Though it's 7 o'clock, but we have few more queries, doctor. If you
I don't
allow,
mind
can I
taking
ask?
up. I don't
Uh,
mind.
thank you, doctor. Next is from Saurabh. As he mentioned earlier, like can they go for stem cell? So his mom is having cancer. So should they go for it?
Well, don't Saurabh, don't expect cancer to be treated with stem cells. Cancer cannot be treated with stem cells. So if you are taking a stem cell preservation just to treat the cancer, it won't be. Now, stem cell preservation. Now, if you're talking that she has a cancer and should we go for preservation? It is contraindicated. No, it does not matter. You can go for stem cell preservation irrespective of this cancer, your mom having this cancer. So either way, if you are thinking that this stem cell preservation is going to cure your mom, no. If your mom is having a cancer, is it going to affect the stem cell preservation? No, it's not going to affect. So either way, irrespective, you can go for preservation. I don't know.
Doctor, we have next question. Her LMP was 24th of December. Doctor gave her delivery a C-section date for 21st of September. Is it okay? She feels heaviness while walking and she has gestational diabetes also. Fasting 80, after breakfast 1 hour it was 180. After lunch 124 D, and after dinner 1 hour it was 150. So is her
Per-
condition okay to have C-section?
Perfect. Perfect. Perfectly managed. Your doctor has managed it so perfectly. And I think she must have done the scan before giving you a date. So I think this is okay.
Thank you, doctor. So we are taking two more queries.
I
Next
don't
is
mind.
Pratibha. She is 13 weeks pregnant and her blood group is A negative and husband's O positive. Her indirect Coombs test is positive with 1:8 dilution. What are the risks and are there any precautions she can take?
Well, now you, as far as the precaution is concerned, it's not much on your side, but definitely your doctor will let you know, because see, right now you're 13 weeks, and I think she'll advise you something at about 16 weeks again at about 22 weeks. So be in touch with your doctor and be in touch with a fetal medicine expert also, and they'll follow up this case. So you need to be in touch with your obstetrician, you need to be in touch with your fetal medicine expert, and they'll get one more test done to look into the dilution. Yeah, you are high risk, so you be in touch with your doctor.
Thank you, doctor. In the previous question, like she's also asking, she's using insulin 6 unit in daytime and 5 unit at night. So is there any problem?
Perfect, because see, your diabetes is perfectly managed, so this units of insulin is perfectly okay.
Thank you, doctor. Next is from Ruchika. 9 weeks of pregnancy and 7 days. Which type of care she should take?
First and foremost, go and show it to your doctor. Second thing, have a good food, have a healthy and happy life right now.
And the last question from Apurva. 6 weeks of pregnancy and doesn't feel like eating green veggies or any other healthy food. So she's so surprised that she used to love eating healthy food. and she was a food lover, but what should she do for this now?
Don't force yourself, Apurva, because this is only time being. 6 weeks is a very notorious time for any type of nausea. To for the food aversion. So you will have this food aversion for time being, and once your this time passes, you'll again start liking your green veggies. So don't worry, don't force yourself that no, you have to eat green veggies. Okay, fine, you manage for something else, and after some time again you will go with this food back. So don't worry, don't panic.
Thank you, doctor. Actually, we have got two more questions, and they seem to be.
Do we want to take?
Yes, doctor, if you
Okay,
permit.
fine. I don't mind it. Finish it.
Okay. So it's from Dipti, how to avoid stretch marks during and after pregnancy.
Dipti, olive. I would advise olive oil, and there are so many other the to avoid the stretch marks. So many other ointments and the tubes and the lotions available in the market, and it's available over the counter. You can buy them. Consult your doctor, of course. That can I use this? But I like olive oil. So it's olive oil. If you apply 2 times a day or maybe 3 times a day, it is very useful. But otherwise, also the stretch nail, and there are so many other ointments available. Consult your doctor and use it, and you will avoid the stretch marks. And start using well in advance, like about 10 weeks. Start using it, and you can use after delivery also to avoid the stretch marks.
Thank you, doctor. Next is from Rachna. She has completed 35 weeks of pregnancy. Recent visit to doctor show position of baby as breech. Are there good chances that baby will put head down as normal position?
It's difficult, Rachna, because you already completed 35 weeks. It's very difficult that your baby will turn now. So if it turns, it's a miracle, good. And if it doesn't turn, I think your doctor may advise you to go for a planned C-section.
Thanks a lot, doctor, for answering a lot of questions and for the wonderful session we had with you. You really gave a lot of insightful tips to all the to be moms. It was pleasure having you on the session, doctor. We really enjoyed.
Thank you, Pooja. Thank you, Pooja, and thank you everybody who has joined me on iMumz. And thank you, iMumz and Pooja, especially you as well.
Thank you,
Okay,
doctor, and
bye.
thank you everybody for joining the session. We'll see you tomorrow. Take care, doctor. Take care, all the to be moms. Bye bye.
Bye. Bye.
Bye, doctor.
Bye.